I think Bermuda as a jurisdiction has been very pioneering in terms of how they provide for health care for the population.
Well, for a small island, I think we do exceptionally well.
I guess one of the most significant developments in health insurance in Bermuda was the passage in 1970 of what was then called the Hospital Insurance Act.
You've recently heard of future care, and I think that is a step in the right direction to be able to provide even more comprehensive coverage for people that need the type of treatment that is not available in Bermuda, and they can go overseas and have the treatment and also have additional funding, providing 100% subsidy for children up to the age of 21. We also extended the subsidy benefit for the elderly, persons over the age of 75 years of age and over. They were entitled to an additional 10%, so their benefit went from 80% to 90% of the standard hospital benefit.
During that time, the plan provided for hospitalization only. There was no doctor's visits or this sort of thing. And there was a limit as to the number of days a person could spend in the hospital. There was a 70-day limit.
This enabled most working people to have hospital insurance and a large portion of the population to have major medical insurance.
I could think of renal dialysis, which is covered under health insurance. Kidney transplants, a certain amount is paid towards a kidney transplant. Things like artificial limbs and artificial appliances like pacemakers, those sort of things have been added to the program. We've had mammograms.
I've been very fortunate in things that have happened to me. Just had a stroke, and I know that in the last year what I've paid into the healthcare, I certainly couldn't afford it. I don't think you can find anywhere in the world whereby you can get something better for your money.
Every employed person has to be covered, no matter what, by law, in some sort of health care plan, be it the basic HIP government-run program or a private plan.
Some of the changes that we've seen in the past few years have been driven from the government. We've seen future care come in, we've seen the urgent care centre developed, we've now got the new hospital approval, hopefully starting in the next couple of months.